This is LiveWell Talk on cleaning procedures as a result of COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health St. Luke's Hospital. While the peak of COVID-19 pandemic has passed and is unlikely to return in a surge fashion, safety precautions are still top of mind for patients as well as hospital team members and clinicians. As a result of the pandemic, St. Luke's has implemented several new cleaning procedures to ensure your safety while visiting the hospital. Joining me to discuss those today is Susan Woods, Environmental Services Supervisor at St. Luke's. Welcome, Susan.
Thanks for having me.
Nice to have you. Cleanliness is next to godliness.
Correct.
You know, so I mean, I think one of the pillars of a hospital is the expectation of a clean environment. I think that's something people can relate to, that some people see, and I think, you know, your team does a great job of that.
Thank you.
And very proud of them. I made the comment the other day that I expect no fear from nurses and physicians and respiratory therapists, but I was so impressed with the absence of fear that I saw from environmental services, maintenance, how these people just stepped up during this time. So I'd like to talk about some of the things that we did. Also make it clear that we have cleanliness all the time. This wasn't like a new thing. You know, it kind of upset me that, or worried me how like people had to be reminded to wash their hands after they went to the bathroom. That kind of scared me a little bit. And particularly since there was no toilet paper, so that was even more worrisome, you know, but anyway, so I know it's a top priority. What are some of the steps that were taken as a result of COVID that maybe you enhanced previously that you were doing?
The high-touch areas like elevator buttons, light switches, doorknobs, handrails, we try to do multiple times during the day. We've asked our staff to even take oxicide rag that we use for our disinfectant or a cavi wipe when they go to break and wipe down their pathway to there. We have a place on first floor that they discard that, and then they can continue washing their hands and go on to their break or lunch.
Now the cavi wipe, is that an alcohol-based or bleach-based? What is the chemical in that?
That's alcohol-based.
Alcohol-based.
Yes.
And the alcohol, what is it? It's 60 or 70% that you want.
70%, I think.
70%
I believe,
to be effective in this situation. Well, I know significant cleaning happens all the time, but the emergency department is one that people are coming to, right? You know, and that's the 53,000 to 60,000 visits a year, as opposed to 25,000 admissions to the hospital. So a majority of the front door of the hospital is the emergency room that people come to. What are some measures taken to keep that department clean?
We've recently in the past have upped that to 2 times a day cleaning. We clean it on third shift where we have more accessibility to get into the patient rooms, and we clean it on first shift. We wipe down the waiting area, the input to where the people are coming in several times a day to make sure that we're keeping people safe.
All right. And by wipe down again, it's with that alcohol-based?
Or we actually would use our oxicide disinfectant. It's a 5-minute kill time for keeping a wet surface, which is better than the past disinfectant that we had. So,
you know, that's a point I want to ask you. Okay, so I was at Hy-Vee last night after work, picking, you know, the frantic call to pick up something on the way home, and I noticed in between they were the place where you set your groceries. You know, the
belt.
The belt.
Through, yeah.
I was noticing the belt. They sprayed it down after each person, but they didn't let it dry. Should you let it dry?
Yes, and that's where your kill time comes.
Yeah.
Yeah.
So
you don't wipe it off.
So spraying it down and then just wiping it right off is probably not as effective.
No.
See, that's what I thought.
Yeah. So when we disinfect, we leave our surfaces wet for 5 minutes. When you sanitize, you wipe it off. You can wipe it off right away, and it doesn't have to stay wet for the 5 minutes.
Okay, so they might be using some sort of sanitizer.
Sanitizer, yeah.
All right, which makes sense. You can't wait 5 minutes in between people. So I know we've had some new technology over the years. We have the Xenex machine.
Yes.
EX. It's a palindrome. Xenex, Xenex. And if you've ever been outside the hospital and coming back in and seeing that flash, you wonder what's going on the first time you see it. But anyway, I know that's been around a while, but can you talk about that particular technology and what that does?
It kills the bacteria and virus after it's been cleaned. So our housekeeper would go into a discharged room and completely clean it, top to bottom, under the bed, all the surfaces. And then we go in and we have 2 Xenix machines that are 4-minute cycles and one that has 5-minute cycle that is just continuous. It has a continuous ultraviolet glow the entire time that doesn't have the noise, which we use in our ICU because of the patients. And we run 3 4-minute cycles, 2 in the room and 1 in the bathroom. And so the ultraviolet kills the viruses. We hang up the telephone receiver, we hang up the call button. We do not make the bed until after we're done. Pull up the side rail so all those surfaces are hit by that ultraviolet beam and kill that. So it helps to keep from one patient to the next because that may be a lot of times where you might acquire something. But we're wiping everything down with our oxicide, and then we go in and use the Xenix. We do all COVID rooms that we're called for.
With the Xenix?
Yes, with the Xenix, yep. We even do the exam rooms over at CWCH when they have a suspected COVID that comes in there.
How long, just routine, not anything special, but patient gets discharged, how long does it take a housekeeper to get that room turned over and clean?
If we get in there right away, probably 35 to 50 minutes, depending on how long they've been there, how many items are in the room.
Yeah. I mean, that doesn't sound like a long time, but when you have 12 rooms to turn over, now all of a sudden that's a lot of your days taking care of that, isn't it?
Yeah, we're trying to keep up on throughput to get the patients up into the room so they're more comfortable, not laying on a gurney in the ED, because that's, like you said, most of our patients come in through there. So.
And you've seen the pendulum swing. I can remember when first floor was all tile, and then we put carpet in to keep the noise down, and it made a difference. But, I've always had trepidation about having that carpet there. The tile floor seemed like we could get it cleaner, but, that's another podcast we can talk about.
Yeah, the good thing is now most of our patient rooms we have very few that have carpet in.
Yeah, we went back to that kind
the hard surface.
Particulate,
vinyl.
faux sort of wood flooring, which looks nice. And does absorb a little bit of noise than tile. That's been proven. So there is the new technology, and just if you could touch on the Casper system that uses hydrogen peroxide. Now, that's just continuously flows through the room?
And the difference between that is that's continuous, like you said. It's doing it the entire 24 hours a day. Where Xenix, we go in, we do the 15 minutes if we're using that machine, and then the person, when a person would come in and touch a surface, it may be contaminated again, where the Casper would be continually disinfecting that room.
When I first heard about that, Lori Townsend was telling me about that, and I was like, that doesn't work, But then I did my research, and it's an impressive product, and it's going to be neat how it works over the long term to see if we do see a decrease in transmission. But on the positive note, we have in the last 5 years seen decrease in Clostridium difficile transmission in the hospital, MRSA, VRE. Those have all declined.
And C. diff was a big part of the C. diff decline because we picked a couple areas that had high C. diff rates, and they significantly dropped. And also with the Casper, it is even in our trialed area, the staffing absences declined also. So that's another good thing.
So less people got sick.
Yes, yeah.
From staff standpoint.
Yeah.
That is interesting. Speaking of staff, in the first SARS epidemic, SARS-1, the anesthesiology and housekeeping were the most 2 affected healthcare workers. But we did pretty well didn't we?
We did.
Yeah, we didn't have any anesthesiologists that got significantly sick. So
yeah, we do training every year, and then all the new people get a one-on-one or one-on-two training with our PPE guidelines. And we really are pretty strict with enforcing that, not only for the safety of them especially, but the other patients and our staff. We don't want to transmit it from one person to another. We want to treat people like their family. We care about, and our patients are number one. That's why we're here.
Well, I think that's common knowledge that your department understands that there's a patient on the end of each of their actions. They're measurably preventing disease, really, where as physicians, we hope we can't, just because I manage someone's blood pressure, Yeah, they might not have a stroke 40 years from now. You know what I mean? But you guys are preventing something from happening that within the following days. You did mention the Center for Women's Health across the street. Is there any certain precautions you take differently there?
Well, I mean, we're still concentrating even more so. We've always concentrated on high-touch areas. But we are Xenixing the prep rooms where they come in when they're suspected COVID, and then when they discharge, we go in and Xenix that after we've cleaned.
That's safe for the babies that are over there, correct?
Yes.
Ultraviolet light doesn't.
Yes. Yeah.
I would think so.
Yeah. Nobody's in the room when you do it.
Okay.
Yeah.
But even if they were, it wouldn't hurt
it might affect their eyes and their skin, but you can look through a window. You're just not in the area. We have a cone that's outside that detects the motion, that it would shut it off immediately if it detected anybody in the room. So no, nobody is in the room.
Okay, so it's safe. All right, good.
Yeah.
Well, that's for
Yeah.
young parents. They want to
Yeah.
know those sort of things. Well, this is really great information. I'm so proud of you and your team because they're always there and always helpful. Thank you so much for taking the time to talk about this. Again, this is Susan Woods, Environmental Services Supervisor at St. Luke's. For more information, visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.